This is part 2 of a two-part recording on calculation of doses. We will calculate dose based on the following parameters: calculating child dose based on the adult dose using the age, weight, and body surface area of the child, using the body weight of the patient to calculate the dose, or using the body surface area of the patient to calculate the dose. We'll also solve application problems involving dose calculations using parameters such as age, body weight, body surface area, and the Nett's law or Gihan and George equation, and nomograms with 100% accuracy and of course without assistance. Recommended adult doses for some drugs are often extrapolated to the pediatric population, in which case, of course, the dose that is given to the pediatric patient is usually based off that adult dose. Now, some important information that is needed in performing these calculations, usually the weight of the child, or the age of the child, or the body surface area of the child. Let's look at some of those equations. Now, the first we'll look at is the Young's rule. This is used for children over 2 years old. Now, in terms of the equation itself, you're looking at the age in years. So this is the age of the child. In the numerator and in the denominator, the age of the child is added to 12, which is a constant. And here 12 would be considered the age of the little adult, or 12 years. Now, this equation, of course, there are some limitations to the use of the equation itself. So even though in some settings it is acceptable that as a child approaches the age of 12, the dose of the medication that the child can actually get would start equaling the adult dose, if it is that you should look on the setup of this equation here with in proportion to the adult dose, as a child approaches age 12, of course the denominator approaches 24 in this case. So at that point in time, you should realize, of course, that the child is still getting approximately half of the adult dose, which may not necessarily be accurate in terms of therapeutic doses for the specific child. Another that we will look at as well is the use of the Clark's rule, and this one is based on the weight of the child. And in terms of the numerator, the weight is in pounds. The denominator has a constant of 150 pounds. And a key note here is that it is taken that the average weight of an adult would be 150 pounds. So that proportion, of course, is multiplied by the adult dose in this case. The third one that we will look at is the Freud's rule, and with Freud's rule, this one is used for infants up to 24 months. So over 24 months, this one is not used. And here you have the age in months, and in the denominator, you have a constant of 150. Be careful not to confuse the 150 here in this equation for Freud's rule with the 150, which is in Clark's rule. Due to the difference in the units here, 150 in Freud's rule is months, 150 in Clark's rule is pound. 150 months, if it is that you should divide that out into years, you would get 12.5. Again, looking at that as the age of the little adult. Now, these two, once a child approaches, say, the adult age, these two, you'd realize that the dose starts approaching the adult dose in terms of the calculation or the outcome that you will get when you calculate the dose, or once the weight of the child starts to approach the weight of the average adult, then this may become equal to the adult dose, as the numerator, of course, starts equaling the denominator and the value there becomes 1. Now, when you look in terms of that calculation using the body surface area to estimate the dose that is given to the child, you are more approaching what you would consider an accurate dose based on two patient-specific factors accounted for in body surface area, which is the height of the child and the weight of the child. However, there are still some inherent accuracies here because, of course, that estimation is based on the adult dose of the specific drug and not necessarily data from, say, clinical trials that were developed for this specific drug and for the specific patient population. Now, with the use of this formula, it must be understood or accepted that the average body surface area for an adult is 1.73 meters square. That information is something that, of course, you must know. This is a given or a standard or constant. And then the body surface area of the child should be available as well, or you must be given the weight and the height to be able to calculate the body surface area. The adult dose for this specific medication should also be readily available in order to complete this computation. So taking a look at what we have here, you look at the approximate child dose based on the body surface area. Now, these are three key things that I mentioned earlier. You must have those information in order to be able to compute the child's dose using this calculation or this method. So the adult dose must be given, the body surface area of the child or the patient, and then the average adult body surface area, which I mentioned is 1.73 meters square. Now let's look at an example. So you have a dose of a drug which is 75 milligrams for the average adult, and then you have the average body surface area for the child, which is 0.641 meters square. Now using the equation, here you're just simply substituting the value into the equation. But what information do we have here? So we have that the adult dose for the specific drug is 75 milligrams and the body surface area of the child is 0.641 meters square. The average adult body surface area or constant that we're given is 1.73 meters square. Once you apply all of that to the equation, your responses should look something like this. Now, those methods that were presented earlier are not routine clinical practices due to the varying limitations that are associated with those computations. So the use of the Young's rule, Clark's rule, Freud's rule, or estimating the child dose based on the adult dose using the body surface area. What is being used predominantly are recommended doses from the manufacturer for the specific patient group. And in these cases, what you might have is the reference dose used for, say, the body surface area or the weight of the child. Now, this is not based on an adult dose. The doses are based on the patient's own body surface area or the patient's own body weight. Now, the doses are stated as an amount of the drug for every meter square in the case of body surface area. and this is the body surface area of the patient, or the amount of drug per meter square times the body surface area, and that would give you what is known as the individual dose of the drug. The dose may be stated as milligram per meter square, micrograms per meter square, grams per meter square. All of those denominations are possible. However, just to note that the individual patient parameters is what is used in these calculations. Just a quick look at how to calculate the body surface area. You can use any one of the two equations here. Just take note of the units of measurement in the two equations. So for the Metlo equation, it is metric. And in terms of the units here, you're looking at height in centimeters, and then the weight is in kilogram. And of course, you have a constant of 3,600 in the denominator. You must remember to take the square root once you have completed the computation for the height, weight, and of course find that quotient between those and the 3,600. For the Gihan and George equation, this is in imperial measurements, and here you would consider putting your units in terms of inches, or inches for your height, and for the weight you're looking at pounds. The constant here is 3,131. So now let's look at a practice example. Now we're going to be calculating the dose based on the body surface area of the individual patient. So the dose of the drug Y for lupus is 7.5 milligrams per meter square, and we want to determine how much of this drug we're going to be giving to a child that is weighing 40 pounds and measuring 32 inches. Now, if it is that you're going to be using the Metler equation, notice that pounds is still in imperial measurements, so that we would need to convert to metric, or height is also in imperial measurements. We would need to convert that to metric. So in terms of doing those conversion, of course, 40 pounds, that's 18.18 kilograms, and inches, that's 81.28 centimeters. Conversion here, 2.05 pounds equal 1 kilogram. 2.54 centimeters is equal to 1 inch. So once you work those out, the body surface area you should be getting something such as 0.641 meters square. So the dose here, in terms of doing that computation, you're multiplying the dose per meter square by the body surface area for the individual patient, and that will give you the dose, or the single dose of the drug, based on the statement that was given earlier. So that dose would be 4.8 milligrams in this case. We could also use the Gihan and George equation to calculate the body surface area for the child, using, of course, the imperial measurements that were given to us. So in this case, the height, of course, of 32 inches and the weight of 40 pounds would just be applied to the equation as is. Once you work that out, you'd get a body surface area of 0.639 meters square, which is not much different in terms of what we calculated earlier of 0.641 meters square. Now, in terms of the dose, individual dose that you will get, of course, when you multiply that 7.5 milligrams per meter square times 0.639 meters square, you'd get 4.795. Round that up to one significant figure, and of course, you'd get 4.8 milligrams per dose. We can calculate the dose for a child or an adult based on their own weight as well. Now, this method is commonly used in everyday clinical practice. This is a general method of calculating dose. The dose is often calculated based on the amount of drug, which is either in, say, milligram, micrograms, grams, whatever units of measurement are presented, per body weight of the individual patient, and then the body weight may be represented either in pounds or in kilograms. Now, the dose is often expressed in terms of that milligram per kilogram of body weight, and then it's usually calculated, of course, using the notation below. The individual dose is equal to the dose per body weight times the weight of the individual patient. Now for another practice example. What is the dose of a medicament for a child that weighs 66 pounds if the dose is stated as 2.5 milligram per kilogram? So first we convert pounds to kilograms. And that, of course, the conversion here, 2.2 pounds equal 1 kilogram. So the weight of the child is 30 kilograms. And then we're going to calculate the dose. Here you can simply use ratio and proportion. So 2.5 milligrams of the drug is required for each kilogram of body weight. So X milligrams of the drug will be needed for the 30 kilograms. Once you work that out, you should be getting 75 milligrams for the dose. Okay, so we will also calculate the dose of a drug using body surface area, and this is pretty similar to what we would do when we use the recommended dose per body weight. In this example, what is introduced is some patient-specific information. It indicated here that the patient is renally impaired, and during renal impairment, there are some drugs that the dose of these drugs needs to be modified based on the patient's specific function, because the kidney is an integral organ in the removal of most of these drugs or their metabolites from the body. And so, if it is that the person is renally impaired, the dose of the drug may sometimes be reduced accordingly based on that patient renal function. In this hypothetical example, the dose or recommended dose of the drug for someone with renal impairment is 30%, or to have it reduced by 30% of the usual recommended dose. So in this case, you're only given 70% of the drug. 70% of the 360 milligrams per meter square is 252 milligrams per meter square. So we have patient-specific parameters here. We have the height of the patient, we have the weight of the patient, and all of those are in metric. So we can simply use Geoghegan-George equation to calculate the body surface area for the patient, and once we do that, we can go ahead and calculate the dose of the drug that we're going to be giving. Now, in terms of the specific drug, so we're looking at carboplatin here, and what information do we have? We have the height in terms of 5 feet 2 inches, and remember the conversion here, it's 2.54 centimeters to an inch. We also need to recall that for every foot you have 12 inches. So in terms of converting that, that is equal to a total of 62 inches. Pounds is already imperial measurement. Based on the equation, we'll just leave that as is. So once you do that calculation, the body surface area that you'll be getting for this patient would be 1.476 meters square. Use that to calculate the dose. Remember, we reduce the dose of the drug based on the patient renal function by 30%. So the reduced dose that we're using now is 252 milligrams per meter square. Multiply that by the body surface area and you're going to get 371.952 milligrams. And that is a dose that is going to be given to this patient. Now, if this patient had perfectly functioning kidneys, okay, and no dosing adjustment was needed, it would mean that you're going to be giving the patient 252 milligrams of drug plus the 108 milligrams, which is what you reduced it by initially. So you'd be looking at 360 milligrams multiplied by the patient body surface area of 1.476 meters square. Here's another example that you can work, and I will pause here for some time and allow you to do this calculation, and let's compare our response. Now, in terms of what you should have gotten here, so you're looking at fluconazole tablets. This is a prescription 100 milligram, and what you're supposed to be doing is to give 2 tablets now, and then the maintenance dose is going to be 3 milligram per kilogram twice daily by mouth after food for 7 days. And you're asked to calculate the number of tablets that you need to dispense to this patient. So first you'll of course determine what you know. And in this case, we know that we have available in the pharmacy fluconazole 100 milligram tablets. And we have a prescription here or instruction which says we're supposed to give 2 tablets at once, and then for the maintenance dose it is supposed to be 3 milligrams per kilogram twice daily, and we're giving that for a total duration of 7 days. Patient weight is 147 pounds. Now, since the dosing information is given in kilogram, we'll just go ahead and convert that into kilograms, and you get 66.82 kilograms. So in terms of the dose, that is going to be equal to the recommended dose of 3 milligrams per kilogram multiplied by 66.82, and once you do that, you should get 200 milligrams, or 200.45, approximately 200 milligrams, and that is the dose for this patient. So we haven't quite determined or responded to the question yet. The question did ask us to calculate the number of tablets to be dispensed to the patient weighing 147 pounds. And in terms of calculating the quantity or the amount of medication that you will dispense to the patient, we did establish earlier that to get this information, you need to multiply the dose unit of the drug that is prescribed times the frequency times the duration of therapy. So in this case, we have 100 milligram tablets available. So the patient is going to be taking 2 tablets per dose. So in terms of units, you're looking at 2 tablets per dose. And then in terms of the frequency, that is BID or twice per day. And the total duration for the treatment is 7 days. Now, you must also not lose sight of the fact that the prescription did say give 2 tablets start. So in addition to the maintenance dose, you must also account for the 2 doses that were given as loading dose or start dose. Since 1 tablet has 100 milligrams and we need to give 200 milligrams per dose, we're looking at 2 tablets per dose. Frequency 2 times per day, and the duration is 7 days. That is equal to 28 tablets in total. Now we did dispense 2 tablets as start dose. So in addition to that 28 tablets, you have 2 more. So that is a total of 30 tablets to complete the prescription. So now that you have explored calculating the doses given all of those patient-specific information, what do you do with that information when you are on the other side receiving a prescription for treatment of any specific condition, you need to be where you need to be verifying the doses that you're seeing on that prescription. What happens? So here you have a prescription on the left and you have your pharmacy reference on the right. Now this reference is specific for amoxicillin, and we're looking at, say, ear, nose, and throat infection, and you have information here for mild to moderate infection or severe infection. Now in John's case, John has a severe infection, and based on the dose that you're seeing here as well, John was prescribed 300 milligrams of amoxicillin 2 times a day for 10 days. Question: is this dose appropriate for John? So the first thing that we need to look at here in terms of using the data that is available to us, John's weight is 40 pounds. We need to convert that to kilogram because the dosing information in the reference is in terms of kilograms. So based on that conversion, the weight here is 18.1 kilogram. Secondly, we want to look at the dose. It gives you the dose in terms of body weight per day. So we need to find out how much of the drug John is going to be taking per day, and that is 600 milligrams. Next thing that you want to look at is what is that dose in terms of the patient's body weight. Now, if it is that the patient is taking 600 milligrams of the drug and the body weight is 18.1 kilogram, once you do the computations there, you should get 33.07 milligram per kilogram per day. Now, based on the data that you have for John, 18 kilograms, that's less than 40 kilograms based on the reference here, and the age is 4 years, so that is greater than 3 months. So John would actually fall within this range here that gives you 25 milligram per kilogram per day, given either every 12 hours, or you can go with a every 8-hour dosing at 20 milligram per kilogram per day. Now, is this appropriate? This is actually not appropriate based on the fact that it's noted on the prescription here that John has a severe infection. So what should John dose for the amoxicillin be then, considering that he has a severe infection? Now we've gone through a lot in terms of the calculation of doses. Based on this reference here, this is what is recommended for John's dose in terms of the prescription. So 45 milligrams per kilogram per day is recommended if the child is less than 40 kilograms in terms of weight and older than 3 months. The dose is 45 milligram per kilogram per day divided every 12 hours, or there is an alternative dosing regimen of every 8 hours. Once you work that out, you should be getting 816 milligrams per day. And in terms of the signature or the instruction to the patient, that would also be divided by 2 if we're going with a twice daily dosing, 408 milligrams per dose, and that is given twice daily for the same duration of 10 days as initially prescribed. Now, this is the end of the recording. Now, you can respond to these questions using the contact form on the website, or you can send me an email. I'd like to hear your feedback. What did you learn from this lesson? What is one idea that squared or agreed with your thinking? What did I do or say in terms of techniques or procedures that I went through that really helped you to connect the dot? Or what one thing is still circling around in your head that you may need some clarification for? Thank you.